Welcome to the Natural Doctors. I'm Dr. Jennifer Stagg.
And I'm Dr. Katie Dinello. We're so glad that you're with us today. So we are in the second episode of a 3-part series. So if you didn't listen to the episode right before this one, make sure you go check that one out, because we talk a lot about the innate wisdom of our lands and how we use herbs, and back to kind of to that indigenous wisdom. So that's a great episode. Make sure you watch that one if you haven't. Now, we left off that episode talking about kind of how we started to transition from using herbs as medicine to pharmaceuticals. And so we want to spend a little bit more time exploring how that happened. So in the early 1800s, that was when we actually were able to create morphine and isolate morphine from poppy plants. So if you're familiar with poppy plants, they're these beautiful flowers, these kind of like these reddish, purplish hues, and they're just stunning. But from those, we were able to isolate morphine, which is a compound that we use for pain management, right? And it's pretty strong. And then in the 1820s, we were actually able to develop a drug for malaria. So that was from the cinchona bark. We get a specific compound from there that became really a revolutionary treatment for malaria, right?
Yep.
Which not a huge issue in the United States anymore, but worldwide continues to be a problem. So really important medication there. And then we fast forward to kind of the mid 1800s, and that's when we actually were able to isolate compounds from willow bark to make aspirin, which is a very common drug, a really important drug that we use now. So as our technology improved, and as we were able to really study specific compounds in plants, we were able to isolate them and then understand how they worked in the body, which then allowed us to create these medications. Now, in our last episode, we spent a lot of time talking about how when we do something like that, we're losing the whole synergy of the herb. And that definitely has a lot of consequences, some pros and cons there. Now, you know, as we isolate these compounds to make stronger medications, of course, that can be a pro, right? When people are really sick, we need these higher doses there. But again, we lose that wisdom, we lose that synergy from the plant, which is still really important. Now, as we started to kind of develop, and understand these compounds a little bit more, we kind of go into the 1900s where we're at this point, we're starting to really understand and make synthetic drugs. Now, part of that, happened with what was called the Flexner Report. I remember I learned about the Flexner Report for the first time in medical school, and this was a really big deal because this report was it really shaped the landscape for conventional medicine as we know it today. And so this report was an attempt to really standardize conventional medical care in medical schools. And so it was this report that essentially forced the more alternative, holistic, I don't even want to use the word alternative because they weren't alternative at the time, right? But really this streamline forced holistic healers, midwives, homeopaths, naturopathic doctors. It really forced them out because they didn't want to abide by this conventional approach of these synthetic compounds, right? Because we were using all of these herbs. Now, again, medicine wasn't perfect, it never is. But in doing this, we really lost that innate wisdom, those indigenous plants that we were using. And then with that, we then started to kind of develop, as we know it today, Western medicine. We then were able to start patenting these medications and making money off of them, which you can't patent plants. And so that was kind of another reason why we lost all of this beautiful medicine.
Yeah, absolutely. And that's sort of like, a lot of people feel like that's why we're in such trouble today, right? That we are looking at profits over patients, right? So companies are mass producing synthetic medications for profit, and then people are being told to take them forever, right? Like, this is a medicine you're going to be on for the rest of your life versus just like, okay, here's a medication for an acute illness that you're just going to take, when we say there's a time and place for something versus, chronic subacute sort of stuff, and then let's stay on this medication forever.
Yeah.
So the tides are turning, just like we talked about in the first episode, right? Yeah. So people are starting to understand what this industry looks like, and they're moving back to more, what I would say, sensible ways of managing health, that we need to not only just using plants as medicine. Plants, of course, have an important role. And if you need medication, like, there's a time and place for that, as I said, but that, we, in all of our episodes, we talk about lifestyle medicine, really getting back to treating root causes of why people are so chronically ill in the first place, right?
Exactly. And I think this conversation is a really good example of how we can use both conventional medicine and naturopathic or functional medicine, right? Because in a perfect world, if we have an ailment, we see either our naturopathic provider or a conventional provider, and we hear what they have to say, right? And we want to question that, right? So, for example, if you start with your conventional provider, they're trained to prescribe medications. That's what they know. It's not a bad thing per se, but that is just what they know. And so we take that information, and you might say, okay, I appreciate that. Let me go now talk to my naturopathic doctor, right? And see what they have to say. And can we do a blend of both? So I think it's a really nice starting point for that, because I know people are in a time where they go to a doctor because something's wrong with them, but they want so much more than just a medication, or they want to know what all of their options are so that they can then choose what's best for themselves, right? I think we practice in a really similar way where neither of us feels like a gatekeeper to medicine. And I think in a conventional setting, that's a common practice, right? Where a patient might come in and say, oh, I want to know about this supplement, this diet plan, or can I get this lab done? And a conventional provider might say, I'm not ordering that for you. It's not covered by insurance, or whatever the reason is. But I see it as, oh, where did you hear about that lab? Let's talk about it. Yeah, that might be a great option for you. Or, you know what? I actually don't think we need that for these reasons. So it really is about the full picture. And I just feel like we've become such a reductionist society in Western medicine that we lose that. And so I know it's not possible for everybody, but it is so ideal to have, a naturopathic doctor and a conventional doctor in your care team.
Yeah, absolutely. And so this is kind of like, these are the patients that we have a lot of experience seeing. They're coming in all day long, and they're being told, like, let's talk about the big elephant in the room, statins, okay?
Yeah, it's a great place to start.
This is a great place of, how pharma borrowed from nature. Yes. And, routinely patients are prescribed statins just for elevated cholesterol. And they, just even like their first test, their cholesterol's elevated. Okay, well, you're high, you should take a statin. And, the actual guidelines are first test, then we should actually do lifestyle intervention. Right away, right? Like, that should be the first step, not jumping towards the statin. But statins come from natural medicine. Now, statins come with side effects, and it's just like we talked about, when you start like just pulling one single ingredient out of a natural plant, or in this case, basically, a fermented rice. We're going to talk about red yeast rice, where this came from. You can end up with a lot more side effects because you are lacking a lot of this like beautiful complexity of the plant that has synergy, so you don't need to use as much of it in these higher doses of a single ingredient. And you are, having more cardiovascular effects in the body, not just this one single pathway affected, and less risk of side effects, right?
Exactly. Yeah.
So maybe let's talk about where statins came from.
Where did statins come from? So really, this is a fascinating story. I remember when I learned this, I thought, what? Like, how are more people not talking about this? So statins, come from something called red yeast rice, right? So red yeast rice is a rice, and when we combine it with a fungus, a Meniscus fungus, right? Which I know this sounds crazy. We allow the fungus to ferment the rice. And in doing so, the fungus creates something called monocolins. And there are a couple different types of monocolins. Monocolin K is what we know today as lovastatin, which was the first statin. So we figured out that this monocolin K, it cuts off the production of cholesterol in the body. So your body makes less cholesterol, and therefore your cholesterol levels go down. That's how that works, right? So when we create the monocolins, we specifically, to make a statin, take out monocolin K. Now, when monocolin K is in the body, it's cutting off that pathway of making cholesterol. But when it does that, we also cut off the production of a really potent antioxidant called CoQ10. What happens when we do that, we get a lot of muscle aches and pains, or the word myalgia. You might be familiar with that. And that hurts. That doesn't feel good, right? No one feels good when that happens.
It's an awful side effect.
Versus when we're using red yeast rice as a whole. So in the supplement industry, we add the red yeast rice with the Meniscus, with that fungus, and then we bring it all together, right? We dry it out and we bring it all together so that in that supplement, you're getting all the monocolins, not just monocolin K. And so we're getting that full synergy. Now, those monocolins come with a lot of other amazing properties. They're antioxidants, they're anti-inflammatory, they reduce oxidative stress, inflammation, and so it's this beautiful synergy. And that's why red yeast rice is actually considered in a lot of cultures a longevity food, because we're reducing inflammation, right? It's not just cutting off the cholesterol pathway. It still does that. We're still very effectively reducing cholesterol with red yeast rice versus lovastatin or a statin, but you get the added benefit of that anti-inflammatory, antioxidant effect from all the monocolins.
Yeah. It's a super cool story, right? It came from traditional Chinese medicine. They had the wisdom, understanding that this helped with digestion, it helped with circulation. In Asia, they like a lot of fermented everything. Like if any of you have been to, parts of Asia and China, I went to Taiwan last summer, stinky tofu, like fermented. If you've ever smelled that, that's something. Red yeast rice is not as odorous as that, but it is a really potent medicine, right? So the thing about red yeast rice, again, it gets sort of targeted and labeled as non-scientific. Like this stuff has not been studied, just take this synthetic pharmaceutical because it's been, of course, it has been like extensively studied, but the language around supplements and a lot of natural medicines not having any research is actually, for the most part, not true. Like you can actually find a lot of studies on many of these plants, and red yeast rice is included in that. There was actually a study with red yeast rice in China with 5,000 people. So this is a pretty big study. And it was placebo controlled, and they looked at outcomes in patients who had had a heart attack. So this is, a high risk group, and they studied them and followed them for 5 years. This is the same sort of stuff that happens, the study model that would happen with synthetic statins. And in this, in this study, the dosing would equate to about 10 milligrams of lovastatin. So it's a pretty low dose. And it at that lower dose, it actually outperformed statin, lovastatin, and the other statins that are typically studied 20, mostly 40 milligram doses, which you can, run into more adverse effects with that. But it outperformed it in every area, basically, like subsequent heart attacks, and all-cause mortality. The benefits were pretty robust with that particular supplement. So it's pretty impressive. So if someone wants to think about using red yeast rice, they do your research. It is actually clinically studied, and it is quite effective.
Yeah, it is. And it's such a great example of how we, from herbs, have developed these drugs. And so we should go back to that, right? Okay, another really good example that we previously mentioned is aspirin and willow bark. And so willow bark is very, very cool. I remember the first time I was in the Grand Tetons, we kind of went to a talk by a park ranger, and he was saying that the moose there chew on willow bark all the time. And it's just such a great example, right? Like even animals are in pain. Like we use willow bark for pain, which we'll talk about. But I just thought that was so cool that when these animals are in pain, they know what to do, right? They know what herbs to use. And so you'll just find these huge moose just like sitting in these marshes at the base of the mountains, just eating and chewing.
So amazing. Yeah, that's super cool.
It's really, really cool. Super special area. But we can even trace willow bark back to Hippocrates. So he would tell his patients to use this for aches and pains. It was used by Egyptians for inflammation as well. And then even Native Americans, right, for inflammation and joint pain, that's what they were using this willow bark for. So it's not just one part of the world that has used willow bark, but it's so many different cultures, which is really, really special.
Yeah, I always find that amazing how, people develop this knowledge over many years. And like sometimes we joke about it, well, how did they figure that out? And some of these medicines, they were toxic. So, it could be not so good, but.
But we should use that wisdom, right?
Yes,
like they figured that out for us.
Exactly. So this traditional use has been, really vetted, and we have all of this wisdom and now science to back all this up. So that's the beautiful place that we're in, is where we now have traditional wisdom from herbalists and indigenous use, all of that, body of knowledge. And now we're seeing the scientific method applied to the information that they figured out from just clinically using these plants. And it's really lining up. It's such a beautiful time that we're in, right?
Yeah. Yep. It's very cool. So we can talk a little bit about how we were able to create aspirin from willow bark. And so I'm looking at my notes here, it was 1828 that a Bayer chemist was actually able to isolate salicin, right? Yep. Salicin. And then, salicin is very, very potent. It creates a lot of, it's really tough on our gastrointestinal tract, especially our stomach. It creates a lot of gastritis. And so he then actually from that created salicylic acid. And it's funny, like I did this in my chem lab in college. Like it's not that hard, right?
Yep.
But anyway, so that is also very harsh on the stomach, but then acetylsalicylic acid is what aspirin is. But this, again, comes from willow bark. So we start with willow bark when we make this. Aspirin, right, we use it for a lot of different things now. There's cardiovascular implications there, but pain is the number one thing. Whereas in our clinic, we are using willow bark very regularly. We have a joint formula that we love, and it has willow bark in it, and it works very, very well without all the side effects, right? We have to be careful of how much aspirin we take because it can be really tough on our stomach. It can create ulcers if we take too much of it. But willow bark, that's not going to happen, right?
Exactly. Just like we described, when you take a whole plant, you are going to have protective compounds in that plant too. So there are compounds that are in willow bark that sort of, coat the stomach almost. That's how we could think about it. And it doesn't leave you susceptible to having, inflammation and gastritis. That's the concern with aspirin. And aspirin, like increasingly, is not like a go-to medicine, unfortunately. For, you know, like many years, that was a go-to medicine. And then it turned, now for pain relief, it's Tylenol and ibuprofen. And those come with a lot of side effects as well. So if we're talking about pain relief, we should start to move towards wonderful, lots of natural substitutes. And we're going to talk about a lot of those in the third episode. So stay tuned for our third part of our series. But I love that. Anything else you wanted to say about aspirin?
No, I think that's good.
Okay.
Let's move on. Do you want to should we talk about metformin?
Yeah.
Is that a good one?
We could do that one.
Yeah.
There's a lot of options.
There's so many. We have a lot of examples for you. Let's talk a little bit about metformin here, only because metformin is a really, really common medication. So for those of you who don't know, metformin remains to this day a first-line intervention when we have pre-diabetes or diabetes. So when those sugar levels are starting to increase. The issue with metformin is that it can be really hard to tolerate for a lot of people. I know the majority of my patients who start it say they have some form of GI distress, a lot of loose stools, or stomach upset. It's a really common problem. However, you know, metformin does a pretty good job at reducing blood sugar, so we'll acknowledge that. Absolutely, it does. But it comes from an herb called goat's rue, which
probably no one has ever heard of.
Right, exactly.
Another one of those. Even like willow bark, I feel like no one's heard of that either, right? We just don't know these, which is why we're trying to bring light to this.
Exactly, exactly. But it's funny because the history of goat's rue is the herbalists and healers used to use it when people's urine was sweet tasting or sweet smelling. And that is a very classic sign that you have chronic diabetes going on, right? Because you're spilling sugar into your urine. So so that's a common herb that we can use to treat diabetes or high blood sugar. And that's not just that one. There's a lot of different nutraceuticals now that we can use. Berberine being one of them, right? That's a great one.
Absolutely. We love berberine. We could talk all day about berberine, but that's another option for blood sugar control.
Exactly.
So yeah, I love that. That's another great example of a pharma from nature. And I think I would love to talk about St. John's wort maybe to finish up, because there's a lot to say about St. John's wort. So hopefully we'll have enough time to do it justice. But St. John's wort, again, like maybe a lot of people haven't even heard about what is that? What does that do? Some people, you know, if they start to do a little bit of research and they're looking for something for depression is where this comes up, right? So somebody could go down that path where they're sort of, you know, a lot of people are on the fence about taking an antidepressant. And there are really good natural alternatives and a lot of different things that we can try. And St. John's wort is one of those, right? And this sort of is a parallel to SSRIs. Do we want to talk about the history a little bit here?
Yeah, I'll talk about this. So St. John's wort is very, very cool because it's this beautiful yellow flower, and it actually is a weed. Like a lot of people think it's a weed, and it grows like very easily all over the place throughout the United States, particularly in like the Pacific Northwest and the Northeast we see it. But what's very cool about this flower is that it was named because it blooms around St. John's Day, which is kind of midsummer, right? Peak of the summer, when we have the most sunlight. And so what an interesting parallel that this herb, the energy of this herb is to bring light, to bring happiness because it blooms in that sunlight. And
love that.
I love that. I love that. But it has very ancient roots in Greece and Rome. And so Hippocrates used this. And then even in like European folklore, it was used to ward off evil spirits, which is really cool, right? So we think about that parallel again when we're feeling melancholy, when we're feeling depressed, right? That idea, that connection with evil spirits. So that's the energy of this herb, its essence as well. So it works on both of those ways.
Yeah, absolutely. And we do use that herb also. We think about it as being really important for the nervous system as a whole. And I do want to, I know we're going to run out of time. I do want to talk about St. John's wort and again, research that supports the use of St. John's wort. So some years back, St. John's wort hit the headlines and it does not work, right? This does not work for depression. There's a big study that's come out. This medicine does not work. So first of all, you always want to look at studies. Whenever I see these headlines, I want to get the paper and actually look at what went on in that paper. So the headline, okay, it didn't work in this study for patients with severe depression. And it was compared to Prozac at the time. And it also did not work for severe depression. So the media conveniently left that out of the headline, that St. John's wort and Prozac didn't work for severe depression. Right. But what also was in that study is that St. John's wort worked for mild and moderate depression, which should have been the headline, right? Okay, like we have a plant, low risk of side effects, that is effective for mild to moderate depression. But this is, this really bothers me that this is the messaging that you see in the media. So, and hopefully things are starting to change and people are using different sources for like doing their research and really getting to, understand how effective a lot of these plants are.
Exactly. And that's just one of so many examples of poor research, or it's not necessarily that it was poor research, but it's how it's interpreted and how it's portrayed in the media. And unfortunately, that happens so commonly with herbs. We see this where, we might have one small side effect or one case of somebody having an adverse reaction to an herb, and that blows up headlines. But that happens every day with pharmaceuticals, right? So it can be really frustrating. But yes, St. John's wort, a beautiful herb. It does work very, very well for mild and moderate depression, feelings of melancholy, feelings of sadness. And again, it's not just how it works biochemically, right? But also that energy, that essence that herb brings. That's a huge piece of herbs that we don't talk about enough, is that there's an energy associated with them. So a beautiful herb, absolutely worth trying, and work in conjunction with a naturopathic doctor, right? So that you can really get some solid, good advice about how to use it in terms of dosing and form, but definitely worth trying if you want to try to avoid an SSRI, amongst depression.
Yeah, that's great. Well, so thanks for joining us, and please stay tuned. We're going to spend the next episode in our 3-part series really talking about really effective natural medicines that can be used as alternatives for common pharmaceutical approaches to common, complaints that you might have.
Today, I have a very special guest, Dr. Andrew Lin.
Hello, and welcome to another episode of the Veterans Corner. My name's Chuck Wooden.
Decision for ourselves for this week, if we want to be made well.
Hi, welcome to the crack of dawn. It's Dawn Lombardi. I'm starting the painting. It's going to be the cliffs with some water. Love it.
He took me on the sets of Lost in Space, Batman.
Everybody has a story. What's yours? Until next time.